Stop sounding educated when you're not. Stop weaponizing therapy talk. It is driving me fucking nuts listening to these people today talk about how he's a narcissist, or he doesn't have emotional capacity to process, or he's gaslighting, or he doesn't understand what boundaries are. Stop weaponizing therapy talk. You don't know what the hell you're talking about. You're just looking at a video on TikTok, or your friends told you, a simple word about what your boyfriend or girlfriend is doing, and all of a sudden now they have borderline personality, or they're bipolar, and you don't even know the goddamn first side. You don't know the first thing about what you're talking, but your mouth is running and nothing's coming out. The reality is, understand what we're talking about. But I literally sat in a coffee shop the other day and I listened to this couple talk, and she was like, you don't understand my boundaries, and you're setting my boundaries, and you're doing this and you're doing that. And she's using all these words, and she's word vomiting everything about my profession. And I went over and I asked her, I said, are you a counselor? And she says, well, no, why? And I said, I just was curious. And she couldn't understand why I was asking that question, because I truly wanted to understand what was she talking about. I mean, this poor guy is just getting beat up because, she's using 100 different words about, oh, her boyfriend is a narcissist. Oh, her boyfriend gaslights. Oh, her boyfriend doesn't have boundaries. And they're just projecting all the avoidant attachment issues, as the word she used, on different things. And we really need, as a society and as just in general, stop using these words. These words need to be used in proper context. These words need to be used the right way when we're talking about certain things. It drives me nothing more than to sit there and listen to a bunch of women at a table talk about how he is so unhealthy and he's a narcissist. And then you talk to a bunch of guys and, oh, this woman I dated the other day was bipolar, and this woman, has borderline, and she's crazy, and she's this and it's that. And it's like, dude, what did you do to make her crazy? What did you do to make her feel unbalanced and get provided unhealthy environments? I mean, so, we want to talk about all of these therapeutic words. Like, unfortunately, ghosting is becoming a therapeutic word that people want to throw out there. But, if we're going to have the disagreements, it's not gaslighting. Gaslighting is requiring persistent and intentional patterns. Just because you're in a disagreement doesn't mean that you're getting gaslit. Just because, he thinks that he's above, the men that you've dated in the past, or, doesn't mean that he's a narcissist. He just has personal standards and thinks that he's honestly better than the other guys that you chose. Doesn't mean it's right. It doesn't mean it's wrong, but we need to just stop throwing it out there and labeling everybody with all these words that really don't mean anything to anybody except for me as the therapist that needs to code what the issue is. So, setting boundaries as an ultimatum and talking about that. If my boundaries aren't allowed, you can't have a lunch with a friend, or this boundary or that boundary, and he doesn't set my boundaries, or he doesn't validate my boundaries. Sit down and talk about the boundaries. What did you set? Did you communicate it properly? Did you tell him how it makes you feel? Or are you just going to sit there and talk about boundary, but you don't really put the rule in place for him to understand what it is? That's not fair to him. So again, normal conflicts are going to happen. It doesn't mean he's an avoidant attachment because the conversation didn't go the way you wanted it to go. Just because he decided that he wanted to wear red shirts and this is what he was going to do and talk about himself doesn't mean he's a narcissist. He might be an asshole, but it doesn't make him a narcissist. So we really need to look and talk about the bandwidth of all the information that's out there today, and understand, that the therapeutic language shouldn't be used as a weapon. It's not a weapon. It is here to help people. It is here to help people get better, and we shouldn't be just throwing it around and trying to label people with everything else, because I can tell you right now, if somebody came back and said, you're batshit crazy, you'd lose your fucking mind. And how fair would that feel to you when somebody did that? Like I said, you'd lose your mind. So why gives you the right to say, I'm triggered, I have trauma responses, I have this, I have that? But have you ever gone to therapy? Has it ever been identified? Has it ever been diagnosed? Or the thing that's driving me nuts today is, I have ADD, or I have bipolar. Oh, great. Are you on medication for it? Have you been to a doctor? Have you been diagnosed? Well, no, but I just know it. Okay. But I know a lot of things too. It doesn't mean that they're right. So come on, let's really look at the whole big picture about what's going on, and let's not throw these words out there. Oh, you're just dismissing me. I need clarity. I need, dominance. It's, again, guys, come on. And girls, come on. We're not weaponizing the language. We just need to educate ourselves on what it truly means and what the difference is. In one of my other podcasts, I talk about what a narcissistic feels like to be around and what narcissism truly is. It'll scare the fuck out of you if you've never been around a true narcissist. They are scary individuals. They literally feel like psychopaths because there is no empathy. But to just sit there and say, he's a narcissist or she's bipolar because she's up and down. Yeah, she might be. Is she medicated? No. Has she gone to see anybody about it? Probably not. But if she is, then you better be able to sit down and be a real man that's going to be able to communicate with her and work through those issues if that's the person you truly want to be with. But at the end of the day, guys, weaponizing the therapeutic talk is a bunch of bullshit. To sit there with your friends and talk about borderline and talk about narcissism and talk about bipolar and talk about, boundaries and everything else when you truly don't understand what you're talking about is insane. I had a conversation and I had a client come in and she was talking about her husband and, and his past trauma is this. And, when he was a childhood, his mother did this and this and this and this. And it's like, oh, so you're a therapist now. You're a counselor. Are you a psychiatrist? Are you, well, no, I used AI. I Googled it and I had all this information. That's great. Does that mean, the old commercials that, showed somebody doing something and all of a sudden it's like, are you a doctor? No, but I stayed at a Holiday Inn Express. Yeah, it's the same shit, guys. Come on. At the end of the day, just because you Google something doesn't mean it's that you know it. Just because you studied something doesn't mean you know it. It comes down to the learned experiences. It comes down to educating yourself. So stop using the jargon you don't know. Stop using the information because you heard it on TikTok and some influencer spurting out and word vomiting, about their relationships. It's not your relationship. It's different. You don't know what theirs is like. You don't know the problems you're having. They don't know the problems they're having. Just take a step back. And if you want to start using those words, seek a professional, learn what it means, understand, find the coping skills, and then move forward. But stop weaponizing therapy talk. Again, I'm Chris Kourtakis. I am a licensed therapist. I work with high-achieving individuals. I work with power couples. I work with people that are willing to put the work in to find out the better versions of themselves, to be able to provide hope to them so that they become the best versions of themselves. If you like this video, make sure you hit the like button below. If this is a video with information that you think somebody else should hear, please use that arrow and forward it along. It definitely is going to help me out to grow this channel. And speaking of growing this channel, please like and subscribe below if you like this content, because I'm definitely going to be making some more and want to share as much as possible and want to make sure you're at the top of the list to see this. Again, leave a comment and let me know how many times have you sat in a room and heard somebody use therapy talk as a weapon? How many times have you gone out on a date with a woman who sat there and talked about boundaries and talked about childhood trauma and all this other things? Or, listen to the way the guy talks about his ex-girlfriend. Oh, she was crazy. She was borderline. She was this. She was that. Don't use a word unless there's truly a diagnosis tied to it. So again, guys, we don't need more weapons. We need more hope. We don't need to knock people down. We need to build them up. And that starts with the way we talk. And the way we talk is a reflection of ourselves. Thanks for listening.